Hello and welcome to Below the Hospital. I'm your host, Garland Grisby Sr., Sterile Processing Manager at Sutter Health, CPMC. In this podcast, I ask what some people consider hard questions, but what I think are informative questions about the sterile processing profession. Today, I have with me on the show Dr. Sade Brown. Dr. Brown is an R&D engineer and scientist with the global healthcare solutions company, Owens Minor. With a background in analytical and polymer chemistry, she has also worked at the EPA, or Environmental Protection Agency, and taught as a professor at multiple institutions, including Morehouse College. Dr. Brown, welcome to the show.
Thank you for having me, Garland. So happy to be here.
Now, I know you're busy, so we'll just dive right on into it. So how does your work in your field specifically impact SPD professionals who encounter or use medical device packaging?
Oh, great question. In the R&D field, such as sterile packaging, you have wraps, pouches, and tray liners. My job is just to make sure packaging behaves predictably in your real-world workflow. So assembly, sterile penetration, or sterile exposure, drying, storage, transport, accepted presentation, just to name a few. This means we design and verify materials so they allow sterile penetration and maintain a sterile barrier until point of use, as well as tolerate the handling without tearing or seal failures as it relates to pouches. In other words, we want to make sure the packaging or the steam can actually get in the packaging and the air can get out so moisture can escape and microbes can stay out all at the same time. The balance is not accidental.
You know, I appreciate something you said at the beginning. You said real world use, right?
Workflows,
Real world
use,
workflows, because oftentimes you see stuff on paper and you're like, yeah, that's great, but in the real world, it don't work that way. So I'm glad you brought that out. Now, in reference this information, are there specific safety issues your work addresses or is meant to prevent?
Absolutely. Most of them are the kind that make SPD professionals sigh deeply. The big preventable issues we design against are failures that can translate directly into patient safety risk or rework burdens for SPD. Those include tears, cuts, and holes that, turn into a full reprocess or of the instrument tray, loss of sterile barrier integrity, wet packs, which is one of the most common and frustrating sterilization failures, yes, I would like to say. And that's related to packaging design, wrap selection, tray configuration. Your cycle and drying parameters also play a role. We also look at inadequate sterilant contact, right? So due to poor material selection, incorrect wrapping technique, overloading sets or packaging, if it isn't suited for the cycle. So from that standpoint, the FDA is very clear. Packaging has to allow effective sterilization and maintain sterility until a point of use. And the CDC actually backs that up by emphasizing proper drying, packaging, and storage as essential infection prevention steps. So basically, in short, if packaging isn't doing its job, patients are at risk, and the SPD pays the price in the rework, the delays, and the stress. And that's what we're trying to eliminate.
Yes. I ran into a wet load just recently.
Oh,
and,
my.
Yeah, and I just turned around and walked away and told them to hold on. And they were like, and staff was like, why? I said, oh, it's deeper than just that one tray. It's deeper than that. I said, we got to do that whole thing over and we got to get to the root cause. We got to find out why.
Yep, exactly.
I knew why because I looked at the rack, but again.
Well, at least you knew.
Yeah. So yeah, that rework is something else. It's nothing nice. I'll tell you that much. So, in your opinion, Dr. Brown, what are some of the most notable challenges that the industry side of sterile packaging professionals are currently working on?
Okay, where do you want me to start? No, I'm.
Yeah, see.
So, first, I will say instrument sets that are getting bigger, heavier, and more complex. Mixed materials, Everything pushes drying performance and increases the risk of compromised packaging during handling. Second, I would say wet packs, as you just experienced, versus productivity. So everyone wants a faster turnaround, but physics still runs the show. Yeah. So mass, condensation, airflow, drying time does not care about your staffing shortages or your case schedules. Third, human factors. Even the best wrap or pouch can fail if the instructions aren't clear or if the steps vary from tech to tech. So consistency is hard when departments are stretched thin. Given COVID, and again, lack of expertise or education, wrap technique consistencies, correct pouch sealings, correct chemical indicator placement, avoiding overloading are all simple steps that are hard to execute and to perfectly scale up. So, and finally, sustainability, right? I think I was about to leave that up, but it just clicked. Sustainability. Everyone wants less waste, right? Yes. Which is great, but any material change has to meet the sterile barrier performance requirements, have to meet the ISO's packaging standards. So just because something is greener, it only works if performance is proven.
That's a good one. I'm glad you answered that question like that, because oftentimes a lot of leaders in SPD across the world, we try to convey the same message to our OR teams and our clinics, the folks that we service, about just how minute our work is, right? Some of the things that we have to do to make sure that we can get them this sterile item or these sterile instruments and these trays. Talking about packaging, making sure that it's sealed up right. But they don't understand that. And it's just, I wish they went through some of the things that we went through and listened to some of the folks like you, Dr. Brown, who say, hey, look, they don't care about your caseload. The dry time does not care. Because if it's not dry, then now your case is delayed even more than you thought it was going to be. So, yeah, I wish I'm going to try to make sure my period folks hear this one.
Oh, yes, please.
Is there anything you wish that sterile processing professionals knew about the industry side of sterile packaging field?
Yes, of course. I mean, to hone in on some of the things you just recently stated about you hearing about, physics does not care about your caseload or your dry time, or it doesn't care, right? So 2 things, right? First, we don't design packaging in a vacuum. Lab testing matters, but real SPD feedback is gold.
Yep.
Gold. And it exposes the true failure modes, right? How a wrap tears at the corners, how pouches get nicked in a case cart, how heavy sets behave, what labeling is confusing, and what training gaps are most common, right? SPD feedback is, again, gold. Second, validated does not mean bulletproof. Mm-hmm. Packaging is validated for specific cycles, loads, configurations, and handling conditions. So the FDA actually expects manufacturers to clearly define those limits, but real world practice still matters. And that's why it's very important to follow and adhere to your IFU. Your IFU is your Bible.
Yeah, I know. I mean, I think every episode that I've done thus far, we will go back to the IFU. We always talk about the IFU. But you honestly can't stress that fact enough, because all it takes is that one deviation from the IFU for you to get a bad result. And then, I mean, what is it? What is your answer? Oh, yeah, we didn't follow the IFU. But I also appreciate what you said. Validation does not mean bulletproof. So
Correct.
That's key. That's key. So, Dr. Brown, what does industry bring to the table for end-user focused standards like AAMI ST79?
Great question. Industry helps convert what should happen into what can be verified. In short, industry brings science and the receipts. So we contribute to materials, science, and expertise while understanding porosity, basis weight, fiber structure, abrasion under different real-world conditions. Validation experience that connects packaging performance to sterilization modalities, and real-world distribution, and handling conditions that align with standards such as ISO 11607. Post-market learning as well. So, we learn from the complaints, failure investigations, and the trend data to inform clear guidance for facilities. But AAMI SC79 works because it treats sterilization as a system. And that system includes people, packaging, equipment, and environment, as well as process. So it helps us to translate that into measurable, testable, and repeatable performance that's usable.
Yeah, so you can have it, but if it's not usable, it's pointless. Now, you said something, and I giggled in the back. You said science. You bring science and the receipts.
And the receipts.
And the receipts, because you need the receipts. So now, talking about the science, what is the science behind how sterilization wraps work? And more importantly, what are some best practices for SPD professionals using those wraps?
Okay, so sterilization wrap is engineered to do two things. And that sounds, and what I'm about to say is going to sound contradictory, but it isn't. It's engineered to allow the sterilant in, so steam or other sterilant penetrates through the wrap to contact all surfaces. But it's also working to keep microbes out afterwards, right? So once dry cooled, the wrap acts as a microbial barrier during storage and transport, right? So most common wraps are non-woven polymers, often polypropylene, built as layered structures that we sometimes refer to as SMS, spun bond, melt bond, spun bond. And the fiber network creates a controlled pour pathway. It supports airflow and steam movement during the cycle, but becomes a barrier to microorganisms after sterilization as long as the wrap stays intact and dried. So all in all, that's how sterilization wrap works. Now, on the latter end, you ask the best practices for the SPD. Start with clean, fully dry instruments. The CDC is really, really clear on this. If there's residual soil or moisture, packaging cannot save the outcome, right? The CDC emphasizes clean, dry, inspect, and then wrap or containerize for sterilization. Match packaging to the cycle and device IFU, right? I'm going to say that one more time. Match packaging to the cycle and device IFU. The FDA specifically calls out packaging should be appropriately cleared and compatible with the sterilization parameters used. So if you had a previous sterilization wrap and they were cleared for much more modalities than the current sterilization wrap you have now, you cannot use those same modalities for a different wrap if it's not on that IFU. Yes. If the cycle says 132, you cannot go to 135 if it is not on the IFU. So go ahead, I'm sorry.
No, thank you for calling that out. Thank you for calling that out.
No problem. Also, don't overload your trays, right? So steam can't sterilize what it can't reach. So overpacked sets restrict air removal, steam contacts, and increases drying problems. So sometimes people are trying to figure out where are these wet packs coming from. One of the variables could be look to see if you overpacked your tray. That could be one of the issues. Protect corners and sharp features. And you can do that by having corner guards, tip protectors, proper instrument arrangement. Most wraps actually, their failures are linked to mechanical. As well as, something that you brought up earlier, I think this kind of hones in on wet packs as well. Let drying do its job. If wet packs are reoccurring, treat it as a system issue. Set weight, absorbent materials, tray design, wrap selection, load configuration, cycle and drying parameters or settings. ST79 often refers to facilities lean on for investigating these issues with steam sterilization programs, right? And last but not least, inspect before storage and before use. Event-related sterility depends on package integrity over time and handling events. And if you need something to go to, Garland, just for the listeners, AAMI ST79 steam sterilization guidance reinforces everything I just said. From drying, packaging, loading, and storage, they're all linked. You cannot fix a system problem at just one step.
Thank you for calling that out, just in case anybody wanted to say, well, that's Dr. Brown saying that. No, ST79 calls it out.
It calls it out.
So can you tell me about your work with the Kilmer and Innovations Packaging Group? And how will this high-level work eventually impact sterile processing professionals and end users?
Sure. So happy to be a part of the Kilmer Innovations and Packaging Group. We spend a lot of time helping to close the gap between what manufacturers validate in the lab and what the SPD professionals experience in real life. Wrap technology is often treated like a black box, so you're told what to use, but not always how it interacts with drying performance, load weight, and different sterilization modalities. So a big focus is on education, addressing the disconnect between the manufacturer validation and the real world use. I know I said that plenty of times, but you're going to consistently hear that. And that could be linked to why heavier, denser sets change drying outcomes, event related versus time related, storage and transportation, how compatibility can vary by cycle, load, and modality, and sustainability. I think within the group too, we also emphasize standards, and Amy emphasizes that the sterilization is a system, and our goal is to make that the system more visible and understandable for the SPD teams. So when issues like wet packs or reoccurring tears happen, we want SPD to have the knowledge to investigate the process, like you brought up recently, right? We want you to have that knowledge so it doesn't feel like a personal failure. One of the most important parts of my work with Kilmer Innovations Packaging Group isn't just developing better packaging, it's closing the knowledge gap between manufacturers and SPD professionals. So if we do this right, education becomes just as important as innovation, and better understanding can lead to better outcomes, which will lead to fewer reprocesses and safer experience for both patients and the SPD.
I love it. I definitely appreciate that answer. Dr. Brown, I really appreciate you taking the time out of your day to be with us here on the show, and looking forward to having you back soon.
Oh, thank you, Garland. I want to thank you for having me. I really enjoyed the conversation. And I have to shout out Amy. I'm a proud member of Amy, and to contribute. And I'm so excited to contribute to improving standards that help bring manufacturers and sterile processing professionals together to support safe practices and stronger processes. However, I'm also excited to attend Amy's Standards Week in March and to continue the collaboration. So I hope to see some of you guys there.
That's what's up. I will definitely see you there. As usual, folks, I hope this episode has been useful. We'll be back in 2 weeks with another episode. If you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcasts, YouTube, and Amy Array. Until then, see you when I see you.